13. Diagnosis and treatment of gynecological and pediatric diseases. Diagnosis and treatment of gynecological diseases.
月经不调。 月经不调使经期、经色、经量发生改变，并伴有其他症状，一般分先期、后期、先后无定期。治疗主穴取关元属任脉，是小肠募穴。 三阴交、肝、脾、肾三经交汇穴，两穴相配，能调理冲任。一、血热型，病人平时喜饮酒及辛辣食物，月经多先期，量多，色红，伴心烦口干。 脉弦数，舌红，苔薄黄。治疗可在处方主穴配太冲、太溪，以清热养血。关元平补贫泻法，连转半分钟留针。 三阴交平针法，太溪连转补法，太冲连转泻法，留针20分钟。2、气虚型。 病人脾胃素虚，过劳而致月经先期，量多色淡，心慌，头晕，纳呆，腹胀，便溏，舌淡苔薄。治疗在处方主穴加脾数、足三里，配合主穴可以健脾益气。 主穴治疗同血热型，平针法针脾数，不留针。针足三里。3、寒湿型。 病人因多食冷饮、瓜果，血为寒凝。月经后期7、8天，伴小腹冷痛，行经不畅，四子有块，脉沉，苔薄白腻。治疗配穴为归来。 命门结合主穴，能温经散寒。命门连转补法半分钟起针。归来平针法。 艾条酒归来关元，留针20分钟。4、血虚型。病人湿邪久病，体虚，月经后期，经淡少，窒息，伴心慌、乏力、头晕，脉细无力，舌淡苔薄。 治疗配穴为肝数、脾数、足三里，结合主穴，能健脾养血。肝数、脾数连转补法半分钟起针。针足三里，留针20分钟。
and retain for 20 minutes. 5. Qi stagnation of the liver type. The patient has been upset for several years by menstrual disorders. The menses is purplish with clots and the patient has lower abdominal pain, hypochondriac discomfort, and experiences belching. The pulse is wiry and the tongue has a thin white coating. Treatment.
治疗
Needle the associate points Jianli
配穴为
11,
建里、内
Meiguan
关
pericardium 6 and Taichung
太
liver
冲
3, together with the main points
与
to
主穴
disperse
相
and
配，
rectify the
能疏
depressed
肝
liver
理
energy.
气。
Needle
循
Jianli
针法
then 11
针
at a
建里
15
内
degree
关
angle. When needling Meiguan pericardium 6, make the patient experience a downward
太冲
sensation.
捻转泻法，留
Retain
针
the
20
needles
分
at
钟
these 2 points for 20 minutes. Needle Taichung liver 3 with a twisting and reinforcing method and retain for 20 minutes. 6.
6.
Kidney
肾虚
deficiency
型，
type. Excessive sexual activities leads to
病人房事
depletion of
过
the
多，
kidney and menstrual
导致
disorders
肾虚、
accompanied by
月经期紊
lumbago,
乱、
tinnitus,
半腰酸、
excessive
稀
leukorrhea,
软
and、even
头晕、耳
infertility.
鸣，甚
The
至
pulse
带
is
多
deep and
或
weak.
不孕，
The tongue has a thin
脉
white
沉
coating.
弱、胎薄。
Treatment.
治疗
The needle points are Jiaji,
配
extra
穴
point,
为 T9
肾
加
数
级、
bladder 23,
肾数，
DG,
带多者
spleen
加
8,
地基、
and
太息，
Taishi, kidney
结
3.
合主穴，
They are used together with the main
能
points to
补益
invigorate
肝
the
肾。
liver and kidney. Needle
针
Jiaji,
T9
extra
加
point,
级
and 肾数 bladder
肾数
23.
不留
Do
针。
not retain these 2 needles.
地基泻法，太息补法，
Needle DG, spleen 8 with the reducing method, and Taishi, kidney 3 with the reinforcing method. The patient should receive the treatment
月
once a
经不
day,
调，
starting
在
5
月
to
经
7
来
days
潮
before
前
the
5到
menses
7天
come.
时，每
At
日
other
针1
times,
次；
the treatment
到
is
月
given
经来
once or
为
twice
止
a week.，
平时每周针1到2次。先后无定期者
For the
应隔
patient
日
with
1
no
次，
definite
经
menstrual
期停
cycle,
针
the treatment
，3 个
is
月
given
为一
once
疗
every
程。
other day, except
本
during the
病
menstrual
应注意
period.
经期卫生，
Pay attention to
经期
sanitation
忌
during the
房
menses.
事、坐
The
浴、
patient
游
is
泳等。
prohibited from sexual activities, tub baths, or swimming. Do
进
not eat
食
too
或
much
少
cold or
食
spicy
生
food
冷
and
瓜
fruit.
果、
Do
酸
not
辣
smoke
烟
and
酒
drink
等物，
wine. Keep the
保
lower
持
limbs
下肢温
warm
暖，
and
睡
stay
眠充
cheerful.
足，精神愉快。痛经
Dysmenorrhea. Dysmenorrhea means
妇
that the
女在
woman
行
feels
经前
severe
后
pain in the
或
lower
行经
abdomen
期，
before,
小腹
during,
部
or after
出现较剧烈
menstruation.
疼痛，称痛经。
1.
实证
Asthenia syndrome. For excess syndrome,
治
the
疗
main points needle
主
are
穴
十七
17椎
extra
为
point,
奇穴，
the extraordinary
不论
point
虚
for
实
both
均能
excess
使
and
用。
deficiency types, and
中极
Zhongji ran
是
3,
任
which
脉
is the
与
meeting
足
point
三
of
阴
the
交
brain and
汇
the
穴
three yin meridians of
三
the
阴
foot.
交、肝脾肾三阴交汇穴
which is the meeting point of the liver,
气滞
spleen,
血
and
瘀
kidney
型
meridians. The menses are scanty and purplish. The patient is depressed by
病
the
人
stagnation
情志
of
不
qi in
畅
the lower berea.
肝气
She
郁
feels a
积
distending pain
经
in the
少
hypochondriac
摄
region.
子有
The
块
signs are a wiry
腹
pulse
痛
and a dark
伴
tongue with
胸
a
内
thin
胀痛
coating.
脉弦舌
For those
暗
with
苔薄
stagnation of the qi and blood,
治疗
Meiguan,
在主穴
pericardium 6,
加中
and
脘
Zhongwan,
内关
ran 12 are
能
needles to
宽
open
中
the
理
chest
气
and regulate the qi. Select
在17椎
extra
找
point
压痛
and
点进
needle
针
with the reducing method by
行
thrusting
提
and
插捻
pushing
转
for
泻
1
法
minute.
，1分钟留针。
Retain the needle and take it out after 10 minutes for moxibustion.
艾条温灸10分钟起针。中脘连转补法，半分钟留针。
Twist for 1 minute and give the patient a
中
downward
极捻转
position.
1分钟，使针感下加，留针。加艾条灸。平补平气法，针内关、三阴交，间歇动流针30到40分钟。
Turn the needles intermittently and retain them for 30 to 40 minutes.
寒 寒湿凝滞型。
The patient of the cold and damp type is affected by cold and has had cold drinks during
病人
menses,
因经
which
期受
causes
寒
fewer menses
凝
with
冷，
purplish clots.
导致精量少，
The
柿
pulse
子
is
有
deep
块
and the
痛
tongue
经
coating，is thin,
脉
white,
沉
and sticky.
苔薄白。
Treatment:
治疗
水
在
稻
实证主
stomach
穴
28
加水稻、
and
地基，
DG
结合
spleen
主
8
穴，
are needled as well as the main points
能
to
温经
expel
散
cold
寒。
by warming the meridians.
针水稻，
Needle 水稻 stomach 28 and supplement with moxibustion.
用艾条酒。 地基捻转
Needle
补法，
DG
留针
spleen 8 with
30
a
到
twisting
45
and
分钟。
reinforcing method. Retain for 30 to 45 minutes.
实证疗程为3个经期
For excessive，
每日
type,
1次，
3 menstrual cycles
痛盛者
constitute a
2
course
次
of the treatment
从
once a
行经
day
前
or
2到
twice a
3
day.
天，连续至到
For
疼
severe
痛缓解。
dysmenorrhea, start 2 to 3 days before the menses until the pain is relieved.
虚症
2. Asthenia syndrome. Treatment. The main
治疗
points for deficiency type
17 椎
are 17椎
关元
extra point, 关元 Ren 4,
三阴交
and 三阴交 spleen 6.
气血不
Deficiency
足
of
型，
qi and blood. The patient
病人
feels slight
因四
pain in
体
the
虚弱
abdomen due to weakness.
病后未复，导
The
致
menses
腹
are
部隐
scanty
隐作
and
痛
thin.，There is a
经
thready
淡面
pulse
少
and a pale，
脉
tongue
细
with a thin coating.
舌淡，苔薄。治疗在
The
虚症
associated
主
points
穴
are
加肝
Ganshu,
数、
letter
脾
18,
数，
and Pishu,
配合舌
letter 20.
穴，能调补
All
气
these
血。
points are needled with a twisting and reinforcing method to
17
strengthen
椎
qi
平
and
补
blood.
平泻法1分钟，
Needle
留针，
17extra point with a gentle reinforcing and reducing method.
艾条酒
Retain the needle
10
for
分
1
钟
minute.
起针，
Apply moxibustion for 10 minutes.
捻转补法
Needle
针
肝数
肝数
letter 18、
脾数、关元。
Pishu, letter 20, and Guanyuan,
捻转补
Ren
法
4,
1分钟
with a
留针，
twisting and reinforcing method for 1 minute, and retain the needle.
加艾
Then
条
apply
酒，
moxibustion.
三阴
Needle
交平补平
Sanjiao
泻
spleen
法，
6 with a gentle reinforcing and reducing method.
肝肾虚亏型，
Deficiency of liver and kidney subtype.
病
The
人
patient
因
feels
多
slight
产
pain in the、
防
abdomen
劳
before、menses
冲
come.
任受损，
This is due to
血
impairment
亏
of the
无
qi
力
and ren，
月经
meridians
将
from
尽，
overfertility
小
and
腹隐
excessive
隐作
sexual
痛，
activities,
半
which
腰
causes
酸
feeble blood、
腿软
circulation.、
头昏
The
耳
pulse is deep
鸣
and、thready, and the tongue is
脉
pale
沉
with a
细，
thin
舌
and dry
淡，
coating.
胎薄
Clinically,
偏
she
燥
has，pelvic
临
inflammation
床
and leukorrhea
常
with
伴盆腔炎
lumbago
而有
tendinitis
带
and
下。
Treatment.
治疗在
Besides
虚
the
症
main
主
points of
穴
deficiency,
加 T9
needle
加
T9
紧
Jiaji
肾
extra
数
point,
带
Shen
多
Shu
加
letter
地基
23,
太
and needle
息
the extra points DG
配合
spleen
主穴
8 and 太
能
息
补益
kidney
肝肾
3 for those with profuse leukorrhea in order to invigorate the liver and kidney.
针 T9 加紧
Jiaji
肾数
extra point
不留针，
and Shen Shu letter 23 with a gentle reinforcing and reducing methods.
平补平泻法
Needle
针地
DG
基太息
spleen 8
留针20分钟，
and Tai Si kidney 3.
虚症痛经
The patient
应每
suffering
日
from
扎一次
dysmenorrhea of，
直到
Shu
痛
deficiency
解。
type
以
should
后每
receive
周2
acupuncture
次，疗
treatment
程
once a
3个
day
月，
until the pain is relieved, and later twice a
也
week.
可配合耳穴、
One
磁珠
course
疗
takes
法。
3 months. Magnetic pearl therapy of auricular points is applied together with the
忌
acupuncture.
吃生
During
冷、
the
酸
menstrual
辣、刺
period,
激
it
性
is
食物，
advised to avoid cold, raw,
禁忌游
hot,
泳等。
and spicy food.
闭经。
Amenorrhea.
女子超过18岁，月经尚未来潮，
refers to the
或已形成月经周期
phenomenon of no menses for
有
women
连续中断
above
3个月
18
以上者，称
And
闭
it also
经。
refers to the
本病
cessation
原
of
因很
menses
多，
after at
笼
least 3
统可
months of
分
regular
血
cycle.
滞、血枯两类。
There are 2 types.
血滞经闭，
Amenorrhea due to stagnation of blood.
寒湿凝滞
The
型，
patient is affected by colds. Raw
病
food
人经
intake
期
during
过时
menses
生冷，
causes the
月
menses to
经
stop
突
for
然不
several
行已
months.
4月，
The patient
小
feels
腹冷
cold
痛
with pain in the
胃
lower
呆
abdomen,
脉涩
the pulse is
苔白
unstable,
腻
and the tongue coating is white and sticky.
治疗
Treatment. The first prescription
采用
includes
中级
Zongji, Ren-3,
合谷
Hagu, large
三阴交
intestine 4, and Sanyinjiao, spleen 6. The second
处方二
prescription includes
次
Ciliao,
疗
bladder
足
32,
太阳膀胱经
Guilai,
归
stomach
来
29,
足阳明胃经
and Xuehai,
血
spleen
海
10.
足太阴脾经
Use these two prescriptions
二方
alternately
交替
to
使用
disperse cold
能
by
温经
warming
散
up the
寒
meridians.
中极平补
Needle
平泻
Zongji,
是针感
Ren-3
下
with a
加
gentle
留针
reinforcing and reducing method. Retain the needle. Apply warm moxibustion with 2 cones of moxa.
用温针92状平针
Needle
法针合
Hagu,
谷
large intestine 4,
三阴交
and Sanyinjiao,
留针
spleen
20分
6
钟
at a 15-degree angle. Retain the needles for 20 minutes.
次日行方2
The next day,
次
apply
疗
the second
捻
prescription.
转泻法1分
Needle
钟起
Ciliao,
针
letter 32, with the twisting and reducing method for 1 minute.
归来平针法加温针
Needle
灸2状
Guilai, stomach 29, with the even movement method, and apply 2 moxa cones to warm the needle.
血海泻法
Needle
留针
Xuehai,
20分
spleen
钟
10, with the reducing method. Retain the needles for 20
气滞
minutes.
血瘀型
2. Stagnation of qi and blood stasis.
病人常见
The
胸胃
patient
小
has
腹胀痛
hypochondriac and lower abdominal pain and distension. Treatment.
治疗可在前寒湿凝滞型方医中加内关、太冲，
and Tai Chong, liver 3, in addition to the points of the first
在
prescription
前寒
mentioned
湿
above.
凝滞型方2中
Needle
加中脘、
Ren
行
12,
间，
and Xingjian, liver 2, in addition to the
两
points of
方
the
交
second
替使
prescription
用
mentioned
能
above
行气
to
活
regulate
血。
qi and invigorate blood.
先行方医
Needle
内
Neiguan,
关平针
pericardium
法
6, at a
太冲
15-degree
泻
angle
法
with the even movement method. Needle Tai Chong, liver 3, with the reducing method.
隔日行方2
Needle
中脘平
Zhongwan,
针
Ren
法
12, with
行
the
间
even
泻
movement
法。
method. And needle Xingjian, liver 2, with the reducing method the following day. 2.
血枯精
Amenorrhea
闭，
due to severe anemia.
脾
Asthenia
胃
of the
盛损
spleen and
型。
stomach. The patient has
病
decreased
人平
menses
时
with
工
each
作
passing
劳
month
累，
until
饮食失
amenorrhea
调
for half a year or more
月经
occurs,
逐月减少
which，is due to overwork
以
and
致
irregular
半
food
年不
intake.
行，
At the same
晚胀
time, the abdominal
胃呆
distension,
便
poor
溏
appetite, and loose
脉
stool
虚
appear.
细，
The pulse
苔
is
白
bloody,
腻
and the tongue is
舌
pale
淡
and
胖。
flabby with a sticky white coating.
治疗采用处方医
The first
中脘
prescription includes
关
Zhongwan,
元
Ren
三
12,
阴交，
Guanyuan, Ren 4, and Sanyinjiao, spleen 6.
处方2
The second prescription
天枢
includes Tianshu,
气海
stomach
足
25,
三里，
Qihai, Ren 6, and Zusanli, stomach 36.
二方交替使
Puncturing
用
the above points
能
with
健脾
periodic
养血。
manipulation can invigorate the spleen and nourish the blood.
先行
The
处方
first
医
prescription, needle
中
Zhongwan,
脘
Ren
平针法
12, at a
使针
15-degree
感
angle
向
with the
四周
even
扩
movement
散。
method, giving the feeling of a spreading sensation. Needle Guanyuan, Ren 4, with the reinforcing and twisting method
关
until
元
the
捻转
patient
补
feels
法
a
使
downward
针感下
sensation.
加，用艾
Apply
条温
moxibustion
灸。
at these 2 points. Needle Sanyinjiao, spleen 6,
三阴
and
交
make the patient feel
用
an
运
upward
气法
sensation.
使针感上
Retain the
行，
needles for 15 minutes. Apply the second prescription the
留针
following day.
15分钟。
Needle Tianshu, stomach 25,
隔日行方
and
2
Qihai, Ren
捻转
6,
补
with the
法，
reinforcing
针
and
天
twisting
枢
method.
气海，
The needle is
行针得气
retained
后
and
留针
moxibustion is
加艾条
applied.
灸。足三里平补平
Needle
泻法，
Zusanli,
以
stomach
上均
36,
留针
with the
15
even
分
movement
钟。
method. All needles in this prescription are retained for 15 minutes. 2.
病后血虚
Blood
型，
deficiency after the disease.
若
The
病
patient
后
has a pale
或失血
complexion
后
and feels
气血不
palpitation
足
and
者，
lassitude.
必
The
见
pulse
面
is
色
bloody
黄白
and the、tongue is
心悸
pale
乏
with a
力、
white coating.
脉细、舌淡苔白。 治疗在前皮位受损型方1、方2中加 T9 加剂皮数、肾素。两方交替使用，能补气养血。T9 加剂皮数、肾素。连转补法，行针半分钟起针。闭经治疗为隔日或每日1次，10次为1疗程，间隔3到5天继续下一疗程。行经后再巩固1疗程。忌食生冷酸油腻食品，是易消化的营养食品。崩漏
Metorrhagia indicates irregular bleeding without blood stagnation,
是妇女抽刃损伤，不能固摄引起的不规则阴道出血，量多为崩，淋漓不止为漏。它包括子宫功能性出血，但应排除生殖系统器质性病变。临床分2类。气息血崩
Metorrhagia due to qi deficiency.
病人劳累过度，数氧如崩，胃口不佳，小腹如坠，头昏目眩，脉细弱，舌淡苔薄。治疗采用处方1：气海、足三里、隐白、脾经紧血。处方2：百会、督脉穴，能升提阳气。脾数、关元。两方交替使用，能补气渗血。先行处方1：气海连转补法，运气留针。足三里平针法，隐白艾条根灸15分钟。次日行方2：针百会，艾条90分钟。连转补法，针皮数，行针半分钟起针。针关元，运气留针。
Needle Guanyin Ren 4 with the reinforcing and twisting method. Again, retain the needle.
血热崩漏
Menorrhagia due to blood heat.
该病人频速肝火较旺，喜饮酒，导致下血如崩，色鲜红，致稠气秽，心烦口干，头晕，脉细数，舌红，苔薄黄。治疗采用处方1：气海、太冲、隐白。处方2：关元、太溪、然谷、肾经行血。两方交替使用，能清热凉血。先行方1：针气海。太冲连转泻法，半分钟留针。
Then retain the needles. Moxibustion should be applied to Yinbai spleen 1.
隔日行方2：针关元，平针法运气留针。
Thrusting method and retain the needle.
然谷连转补法。
Kidney 3 at a 15-degree angle and Rangu kidney 2
太溪平针法，留针30分钟。
All the needles above are retained for 30 minutes.
有血瘀现象，可在方1加合谷平针法。3阴 阴交指循法，使针感上行。
Needle Sanyin-jiao, spleen 6, making an upward sensation. On the basis of the second
在
prescription,
方2加次疗，
32 is needle
提插
with
捻转
twisting
泻
and
法，不
reinforcing
留针。
method by lifting and thrusting. Do not retain the needles.
血海平针法，留针
Needle 血
20
海
分钟。
spleen 10. For those suffering from
当者
megaregia,
每日针
excessive
2到
bleeding
3
with the
次
treatment should be given 2 to
漏
3
者
times a day.
每日针
For
1次
patients with dripping
到
blood,
血止
the treatment is given
血
once a
止
day.
后隔
After
日
the
再
bleeding
加3次
stops,
巩
the
固。
treatment is given once
当
every
者
other
在
day.
大出血
Two
时
extra
应
treatments are
先
needed
止
to
血，
consolidate the effect.
必要时结
When
合药物
megaregia
治疗。
occurs, the first step is to stop the bleeding and take
忌食
medication if
酒和
necessary.
辛辣食物
It is advised to avoid eating
当
pungent
时
foods
绝
and
对卧
drinking
床
alcohol.
漏
When
者
blood
也
dripping
应注意
occurs,
休息
it is
忌
advised to
房
have
事
a good rest and no sexual activity.
胎位不正
Malposition of the fetus. Occipital anterior is the normal fetal
医生
position.
在产前检查
Breaches of the
发
occipital
现
posterior
枕后
position
位
in transverses
臀
after
位
30 weeks
横位
are
等
regarded as
呈胎位
abnormal.
不正
Correcting the position with
针灸转
acupuncture
胎
is
以
appropriate
妊娠
between
29
29
到
and
38
38
周
weeks
时
of
为宜
pregnancy.
治疗
Treatment.
取双
Needle
侧
Jing,
至阴
bladder 67, which is the Jing
足太阳
point
膀
of the
胱
bladder
经进
meridian
穴
of the foot taiyang,
能益
and
肾
it can
调
nourish the
气
kidney
转胎
and regulate the qi to correct the fetal position.
酒前
The
先排
patient is
尿
required to
松腰
urinate
带
and loosen the belt before the
艾条
treatment.
温灸20
Once
分
the
钟
lotion is applied
以不
for
灼
20
伤皮肤
minutes.
为宜
The patient may also receive laser therapy.
也可以用激光
The
疗法
treatment is given once or twice
疗
a day.
程为3到
3
5
to 5
天
days are one course of
如
the
果不
treatment.
正再行
If the
第2疗
malposition
程
of the fetus hasn't
观
been
察5
corrected,
天
an
不
extra
再无
course of
效
the treatment
改
is
用他
needed.
法
If there is still no effect, try another
酒后
treatment.
当晚胎动加多
It is normal for
胎
the
心
fetus to
略有
move
加
more
快
and the
是正
heartbeat
常
to
现象
accelerate after acupuncture.
治疗期
Acupuncture
日常
is
生
not
活不受
recommended
限
for
制
those with habitual
有习惯
miscarriage
性
or
早产
toxemia.
妊娠毒血症者忌酒 乳少
Lack of lactation.
乳汁
The
是
puerpera
气血所
fails to
化
supply enough milk for
产
her
妇
child
乳汁分
because
泌
of
不
her
足
deficiency
不
of
能满
qi
足
and
婴儿
blood
需要
or
为乳
stagnation
少
in the milk meridian.
治疗
Treatment.
取
The
膻
main
中
points are
气之
Danzhong
会穴
17, which is the center of qi.
乳根
Rugen
足
stomach
阳明胃
18,
经
the stomach
穴
point of the foot
是
yang
局
ming,
部取
and
穴
Shaozi small intestine 1, which is the
少泽
Jinghao point of the
手
small
太阳
intestine
小肠
meridian
经
of the
经穴
hand taiyang.
三血
Acupuncture
相
these
配
points can
能
promote
通乳
lactation
络
by
以下
nourishing the
奶
blood.
针膻中先沿皮向下刺
Danzhong Ren
将
17,
针提起
then lift the needle
向左右
and
乳房
insert
横
into the
刺
right and left
然
breasts
后
in a
向下刺
horizontal
留
direction
针
with the twisting and reinforcing method by lifting and thrusting for a half minute. Then insert the needle downward and retain. Insert a short needle into Rugen stomach 18 upward, about 0.5 centimeters deep. Do not retain the needle.
乳根用短针向上刺约2分深，不留针。艾
Apply
条
the
酒
combustion
酒
at the
上穴，
above-mentioned points to warm the needles.
少则用点
Shaozi
刺法
small。intestine 1 with quick
本病
incision.
应每日针1到2次，疗程3到5天。
The treatment is given
一
once
般
or
以
twice a
年
day
轻
for
胎
3
次
to
不
5
多
days to make
产
one
后1月
course.
内及乳房发育正常、
The
无明显
prescription
气
has
血不
better
足者
effect
效
on
果
young
较
women
好。
with fewer births,
同时
normal
应注意
breasts,
营养
and no，
多
obvious
饮汤类
deficiency of qi
按
and
时喂
blood.
奶，保持睡眠充足，精神
Pay
愉快。
attention to nutrition and eat more soup. Feed the baby regularly and have sufficient rest and maintain good spirits.
不孕
Infertility. The infertility of a childbearing age
女子
woman
在
who
月
has
龄
lived
期
together with a healthy
婚
spouse
后
for
夫
3
妻同居
years
3年
is
以
called
上，
primary
配偶健
infertility.
康不能受孕，
Infertility of
称
3 or
原
more
发
years
性不
after a
孕。
previous pregnancy
婚
is
后
called
曾有过妊
secondary
娠，
infertility.
相继3年以上未孕，
The
称
acupuncture
继
treatment
发
should
性
be
不孕。
based on the exclusion of
治
the
疗可
following
分5
cases.
型： 针灸治疗应排除一、生殖器发育不全、异常、器质性病变；二、内分泌卵巢功能严重障碍；三、慢性消耗性疾病等所致的不孕。治疗采用主穴处方一、关元、子宫、经外奇穴，是指不孕症的经验穴；三阴交、子户抱门也是经外奇穴，是治不孕症的经验穴；大壑是冲脉和肾经交汇穴；血海、脾经穴。两方交替使用，能温补奇经，调理冲任。血虚型。病人平素身体较弱，婚后3年经期落后，量少，色淡，脉沉细，舌淡苔薄。治疗在主穴方一加甘树、足三里。方二加肾数。
In addition, for the second group of points, add Shenshu, bladder 23, and Jiaohai, kidney 6, to invigorate the qi and nourish the blood.
先行方一，
Needle
先针
Ganshu,
甘树
bladder 18 first, with a twisting
连
method
转
for
半
half a
分钟
minute.
起针。
Then withdraw the needle.
连转补法，针
Needle
关元、子
Ren
宫，
4, and
运
Zigong
气
extra
使
point
针
with a
感下
twisting
加，
and reinforcing method.
加温针
Combine
灸两
treatment
壮。
with moxibustion using moxicones.
平针法，针足三里、
Puncture
三阴交，
Zuzali, stomach
留针
36,
20分钟
and Sanyinjiao, spleen 6 at a 15-degree angle, and retain the needles for 20
隔日
minutes.
行方二，
Needle the second
肾
group
数
of points the
连
next
转
day.
不留针。
Needle Shenshu, bladder 23, with the twisting method. Do not retain the needle.
子户、抱门、
Needle
大壑
Bauman,
连
extra
转补
point,
法。
and Zihu, extra point, with a twisting and reinforcing method.
温针灸两壮，
Moxibustion using 2 cones of moxa is applied.
血海、照海均补
Needle
法，留针
Xuehai,
20
spleen
分钟。
10, and Jiaohai, kidney 6, with the reinforcing method, and retain the needles for 20 minutes. 2.
肾虚型，
Infertility due to deficiency of the kidney is
肾
always
虚不
accompanied
孕，
by
易
irregular
见月经失
menstruation,
调，
scanty
量
and
少色
light-colored
淡
blood,
带多，
excessive
腰酸
lipuria, weak
头昏耳
loins,
鸣，并
dizziness,
伴有宫颈炎
tinnitus,，
脉
cervicitis,
沉
a
苔
deep
薄。
pulse, and a thin coating on the tongue.
治疗
Needle the 2 groups of the main points mentioned above
在
in
主穴处
combination
方
with
一二
Shenshu,
加肾
bladder
数、地基、
23,
照海
Jiji, spleen 8,
可
and
以
Jiaohai,
补肾
kidney
益
6,
精。
with the reinforcing method to nourish the kidney and strengthen the essence.
主穴操作如前法，
Needle Shenshu, bladder
针肾数
23, but do
不留
not
针。
retain the needle. Needle DG, spleen 8,
针
and
地基照海
Jiaohai, kidney
留针
6,
20 分
and
钟。
retain the needles for 20 minutes.
痰阻型，
Stagnation of phlegm.
病
The
人
patient
婚后
has
6
failed to
年未
have
育，
children after 6
月
years of
经近来
marriage.
逐月减
The
少，
menses have
色
become
淡，
scantier in amount and lighter
自
in
感体
color,
型日
while
胖
her，weight has
脉
increased.
弦滑，苔
The
白。
pulse is wiry and the tongue is thin with a white coating.
治疗
Puncture
在
the
主
first
穴
group
方
of the
一
main
加
points,
中极
Zhongji, Ren
丰
3,
隆，
and Fanglong, stomach 40.
方二
The second group of Pishu,
加
bladder
脾数
20,
阴陵
and
泉，
Yinling Quan, spleen 9. To invigorate the
两
spleen
方交替
and
使用，
eliminate
能
phlegm.
健脾化痰。主穴操作如前法，先行方
Needle
一，
Guanyuan, Ren 4, and
平针
Zhongji,
法，
Ren
针
3
中
at
极
a 15-degree，
温灸
angle.
二壮。
Moxibustion with 2 cones of moxa is applied.
丰隆泻法，留针20
Puncture
分钟。
Fanglong, stomach 40, with the reducing method, and retain the needles for 20 minutes. Needle the second group of
复
points
诊
on the
型方
next
二
visit. Puncture 皮数 bladder 20 with the twisting method for half a minute and withdraw the needle. Insert 血海 spleen 10 and 阴陵泉 spleen 9 with the reducing method by lifting and thrusting and retain the needles for 20 minutes.
宫寒型
Cold evil in the uterus. The patient has scanty and dark blood in the latter part of the menstruation period. A feeling of cold pain in the lower abdomen, weak loins and cold limbs, a deep pulse, and a pale tongue with a thin and white coating. Puncture the first group of the main points mentioned above in combination with the extra points Human, Du4, 肾腧, bladder 23, and Zhu Sanli, stomach 36. Treat the second group of the main points mentioned above together with the extra point 肾雀 Ren 8. The alternative puncture of these two groups of points can expel the cold by warming the uterus. Puncture 命门 Du4 and 肾腧 bladder 23 with the reinforcing method and retain the needles for half a minute and then apply moxibustion for 5 minutes. Needle Zhu Sanli, stomach 36, and apply warm moxibustion at 肾雀 Ren 8. 5. This patient has borne no child after 4 years of marriage. There are clots in her menses accompanied by distending pain in the lower abdomen and breast. Her pulse is wiry and the tongue has a thin coating. Puncture the first group of the main points mentioned above in combination with Hegor, large intestine 4, and Taichung, liver 3. Combine the second group of the main points mentioned above with Ciliao, bladder 32, and Zhu Sanli, stomach 36. The alternative needling of these two groups of points can regulate qi and dissipate blood stasis. Needle Hegu, large intestine 4 at a 15-degree angle. Insert Taichung, liver 3, with the twisting and reducing method and retain the needles for 20 minutes. Needle Ciliao, bladder 32, with a twisting and reducing method for 30 seconds. Then withdraw the needle. Then needle Zhu Sanli, stomach 36, with the twirling reducing method and retain the needle for 20 minutes.
治疗不孕应隔日针1次，10次1疗程，间隔5天，续下1疗程。经期停针，2个疗程后改为月经前后各针灸5次。
The treatment is given once every other day. 10 treatments constitute 1 course of the treatment. 5 days later, the second course begins. Stop acupuncture during the period of menstruation. After 2 courses are completed, it is altered to give 5 times of the respective treatment before and after the menses. During the treatment, attention should be paid to indications of ovulation and copulation. Avoid excessive sexual activity. Chinese medical herbs may prove necessary for a successful treatment. Pediatric diseases. Enuresis. Enuresis means bedwetting by children aged over 2 years old. It occurs several times at night for some children. The patient's kidney qi becomes deficient due to continued enuresis. Some patients may become thin, depressed, and jaundiced. Treatment. 2 groups of the main points are used for the treatment. The first group are 肾腧, bladder 23, 关元, Ren 4, and 三阴交, spleen 6. The second group is 膀胱数, bladder 28, 中极, Ren 3, and 大敦, liver 1. Alternately apply these 2 groups of points each day to nourish the kidney qi and strengthen the organ's function by reinforcing the primordial qi. The patient is required to discharge urine before reviving the treatment.
本病均选用1寸32毫毫针，局部卧位，先直刺双侧肾腧，用捻转补法，以得气为度。出针仅按针孔，不留针，以补益肾气。双侧膀胱束的操作与肾腧相同。
on both sides, as was done with Shenshu, letter 23.
仰卧位，屈膝，
In
针关
supine
元中
posture,
极，
slowly and
直
perpendicularly
刺进
insert the
针，
needle into
手法
Guan
缓
Yuan
慢。
Ren 4.
得气后
After
继续
the
运
patient
针，
receives the qi,
使针感
manipulate the
向会
needles
阴部扩散，
continuously so as
不
to
留
spread
针
the。qi to the perineum. Do not retain the needles. Needle Zhongji Ren 3 in
中
the
极
same
和
method
关
as
元
Guan
穴
Yuan
操作
Ren
相
4.
同，
Needling these
具
2
有
points
补益
can
肾
nourish the
气、
kidney
固
qi.
摄下元的作用。
Needle Sanyinjiao
三阴交
Clean 6 is
穴
a twisting
用
and
捻转补
reinforcing
法，
method. Retain the needle for 5 minutes after the patient feels the qi.
得气后
This is to
禁留
regulate the
针
liver,
5分钟，
spleen, and kidney
以
qi
调理
and
肝、
strengthen the bladder
脾、
function.
肾精气，振奋膀胱机能。对肾气不
Moxibustion
足
can be
患
applied
儿，
for
可
patients
配
with
合
yang
灸法
deficiency.
或温灸关元穴，
Apply
以补
moxibustion
益
at
元
Guan
阳
Yuan Ren 4
每
for
次
10
5到
minutes.
10分钟。
This achieves therapeutic effect by invigorating primordial yang and strengthening the qi.
梦中遗尿者加神
And
门，
Shenmen Heart 7 for urination during sleep.
食欲不振加
Add
脾数
Qishu, letter
足三
20,
里。
and Zusanli, stomach 36, for those with poor appetite.
治疗期
During
间
the，treatment,
需家属
parents
密
should
切配
strictly
合，
control their children's
晚
intake
餐
of
结
water
束
at
前
dinner
要
and
控制饮
before
水
sleep.
夜间按时排尿，
Discharge urine
适当户
regularly
外活
before
动，
sleep,
感
and
悟
plenty
疲
of
劳
outdoor
过度。
activities are encouraged. Acupuncture treatment can achieve very good therapeutic effects on enuresis. For
针灸治
enuresis
疗遗
caused by
尿效果
organic
较好，
diseases such as
但
deformity
对
of
器
the
质性
urinary
病病
tract,
如泌
latent
尿道
spina
畸形、
bifid,
隐
and
性脊柱裂
oxyriasis,
以
the
及脑
primary
虫病
disease
引
should
起
be
的遗
treated
尿，
first.
应治疗其原发病。肝肌
Infantile malnutrition.
肝肌
Infantile
是指小儿
malnutrition
患
is
有
a
肝
symptom
疾
caused by
而有机
insufficient
制的
feeding,
症候，
nutritional
多因喂
imbalance,
养不
and
当
food
或营养失
preferences.
调，
Thus, the
长
stomach
期
and
偏
spleen
食
are damaged.
干、腻、生、冷、辣，脾胃损伤，形体失养。
Treatment. Puncture
治疗
Qishu, ladder 20,
取脾数
Weishu, ladder 21,
胃数
Xiawan,
下
Ren
脘
10, Zusanli, stomach
足三里
36, Shangqiu,
商丘
spleen 5, and
四缝
Sifeng extra point in
以
order
调
to
补脾
regulate
胃
and nourish
消
the
积
spleen and
化滞
stomach and relieve dyspepsia.
取腹卧位，
In bone
针刺
posture,
脾数
needle
时，针
Qishu,
灸
ladder
向
20,
脊柱斜
and
刺5分，
Weishu, ladder
得气
21,
后
point
做小
5
幅度
twice.
捻转补法，
After the patient
出针
receives
时
the
紧按
qi,
针孔，不
twist the
留
needle
针。
slightly with the reinforcing method. Press
肾
on
腧
it
穴
when
的
you
操
take the
作
needle out.
与脾数相
Do
同
not retain，the
可轮流针刺，以健壮脾
Needle
胃
Weishu,
补
bladder
中益气。
21, in the same method as Qishu, bladder 20.
针
Needle
刺
these
下
two
脘
points
穴
in
时
turn to
取
strengthen
仰
the
卧
stomach
位
and，spleen,
直
reinforce
刺
the
约
middle
5
warmer,
分。
and promote qi circulation. In
得
the
气后
supine posture,
行呼
needle
吸补法，
perpendicularly at
或配合
Xiawan,
轻
Ren
度
10
震颤
at a
手
0.5
法，
twin
不
depth.
留针，
After the
以
patient
和
gets
胃
the
理
qi,
肠，消
apply
积
the
化滞。
reinforcing method by the breath
针
or
足
by
三里
shaking
时
without，
做
retention
小
of the
幅度
needle.
提插
The
拧转，
function is to
配合
regulate
震
the
颤
qi
手
of the
法，
stomach
不
and
留
to
针。
promote digestion.
足三里为胃之和
Puncture
穴，
Zusanli,
针之
stomach
以
36,
扶
with
正
a
和
slight
胃。
lifting, thrusting, twisting, and shaking method.
四
Do not
缝
retain
穴
the
用
needle.
点刺法，
Give
读后
四缝
左
extra
手
point
捏
with
紧
quick
手指皮
incision.
肤，用
After
3轮
local
针或
sterilization,
5分
squeeze the
26号
finger with
针
the left hand
做
and
垂直
needle
快速
4
点
缝
刺，
extra point with a
刺
quick
后
incision
马
by
上
the
挤
right
压皮
hand.
肤，挤出
Squeeze the
黄
finger
色
until
粘
a little
液，
blood comes out.
以挤出
This
渗
method is
水为
helpful
主
to。strengthen the bone and improve
此法
digestion.
有助于骨
The
骼发
treatment of
育
the，quick
并
insertion
提高消化
method
功
is given
能。
once every other week.
点刺时要注意消
3
毒，
times are
严
enough
防
to
感
have
染。
effect.
隔周1次，3次可见效。 商丘穴为脾之经穴，点刺能消积化滞。用浅刺急出法，不留针。针刺治疗隔日1次，10次为1疗程。2个疗程间隔1周。治疗期间应定时定量进餐，不宜过饥过饱或过食香甜油腻生冷食品。平时多做户外活动，以增强体质。如果肝积是由于肠道寄生虫、慢性泄泻及结核病等所致，应首先治疗原发病灶。小儿麻痹后遗症。小儿麻痹后遗症是感染脊髓灰质炎病毒引起的肢体瘫痪症状。早期针灸治疗对肢体功能的恢复、纠正骨骼畸形有明显的效果。下肢瘫痪。治疗可用闭关、伏兔、足三里、解析作为主穴，采用毫针点刺补法，沿足阳明经自上而下分点点刺，闭关、伏兔、足三里、解析等穴，不留针，以疏通阳明经气，濡养筋骨。膝反屈，这是膝反屈患儿，站势不稳。治疗由主穴加腰夹脊穴、承扶、尾中、承山组成。针夹脊穴，选用1.5寸32毫针，针尖向脊柱方向斜刺0.5寸，能调节内脏功能，输出下肢精气。
This method can regulate the function of the internal organs and smoothen qi in the lower limbs. Needle 承扶 bladder 36 perpendicularly 2.5 centimeters deep.
捻转得气后即出针。
as soon as the qi is obtained.
尾中承山，采用点刺法。
and Changshan bladder 57 with quick
诸穴相配，以通调膀胱经气。
with dredging of the bladder meridian.
内翻足。
Pes equinovarus. The main points needled are Yangling Quan, gallbladder 34, 飞扬 bladder 58, 玄中 gallbladder 39, and 丘虚 gallbladder 40. For long-term paralysis patients, the twisting and reinforcing method should be applied, retaining the needle after the patient feels the qi.
丘虚穴，针尖向照海穴方向斜刺3分。
so as to nourish the tendon and bone. Needle 丘虚 gallbladder 40, 0.3 centimeters deep against 脚海 kidney 6. Needling 飞扬 bladder 58 can correct the symptoms of Pes equinovarus.
上肢瘫痪。
4. Paralysis of the upper limbs.
上肢瘫痪者治疗主穴有天柱、大椎、肩盂、曲池、
large intestine 15, 曲池 large intestine 11, and 合谷 large intestine 4 of the affected side.
针天柱穴时，患儿微低头，直刺0.3寸，得气后即出针。
Take it out
大
after the
椎
patient
为
feels
诸
the
阳之
qi.
会，
Needle 大椎
针刺
14,
可通
which is the
调
meeting
上肢
point of the
3
yang
阳经脉
meridian,
之
and
精
can
气，
promote and regulate qi of the 3 yang
分别
meridians
点
in
刺
the upper
肩
limbs.
盂、
Needle separately,
曲池
Jinyu, large intestine 15, Chuchu, large intestine 11, and Hegu, large intestine 4, with quick insertion to
合谷
smooth the qi
以
of the
疏
yang
通阳明
meridian
精
and
气，
regulate
调
the
和气
circulation of
血。
qi and blood.
提臂困难。
difficulty in raising the arms. In addition to the main points, needle
提臂困难者的
10,
治疗
small intestine 11,
由上肢主穴
and
加
B
天
now,
宗
large intestine 14.
臂闹
On the affected side, pull 3 twin deep with quick
天宗
incisions
穴
to smooth
直
and
刺3
activate the
分
meridians.
点刺不留
Do
针
not retain the needles.
臂闹穴操作与天宗穴相同。腕下垂
6. Dropped wrist.
腕下垂患者的治疗，由主穴
Needle
加患侧处的
4,
四
Sanjiao
毒
9,
外关
and
组成。
Wangguan Sanjiao 5 in addition to the main points.
直刺四毒
Sanjiao 9,
外关，
and Wangguan
连
Sanjiao
转得
5
气
on
后
the affected
净
side
留针20分
perpendicularly.
钟，以激
Retain
发少
needles
阳
for
精
20
气。
minutes after the patient feels the qi. This is to stimulate qi of the Xiaoyang meridian.
小儿麻痹症的治疗，隔日1次，12次为1疗程，
The
隔1
treatment
周
is
后
given once
进行
every
第
other
2
day.
疗程。
12
治疗
treatments
期间
constitute one，
家
course of
属
the
需耐
treatment.
心配合，
A
在医生的
1-week
指
break
导
is to
下
be taken
对
before
患
the
儿
second
进
course
行适当
begins.
的功能锻炼，
During
随
the
时
treatment,
纠正畸
parents
形，
should
以
cooperate
提
with the
高疗
doctor
效。
by helping their children do some passive exercises in order to help correct the deformity and achieve better results.